Thanks for tuning in to Healthy Planet One, where we discuss healthy living from experts in each of their fields. This is your host, Patricia Starr.
And your co-host, Kimberly Knox.
Welcome. Today's guest on Healthy Planet One is June Drennon.
Well, hello. Thank you for having me
Nice to
today.
have we're going to be talking, we're excited because we're going to have you in two parts. So our first part today, I know we're going to be talking about mindful wellness and thermography.
Yes, that's right.
And we want to know all about you and how you got started and what's your background. So it's great to have you with us today.
Well, thank you. Well, I opened a wellness clinic in Chattanooga, Tennessee, hence the Southern accent, in the year 2002. And I was certified in colon hydrotherapy and lymphatic therapy. And I brought in different practitioners, and we worked with the community for people that were practicing mindful wellness. And I was very fortunate to be approached by Dr. Ben Johnson. You may have heard of him. He was in the movie The Secret. And he was looking for someone to partner with in thermography. He had a clinic in Atlanta working with breast cancer patients, and after a number of years became very frustrated and decided to focus his energies on prevention. And he understood the value of thermography, so he bought the equipment and looked for someone to partner with. And he approached me, and I didn't realize the value of it at the time, and I turned him down. Well, finally, he persevered, and on the third approach, I got it and ended up getting my certification 2008 and started working throughout Chattanooga, where I live, but also the rest of Tennessee.
I have a question for you.
Okay.
When he first approached you, you were like, "No, I don't think so." And why was that? Is it because you didn't know enough about it?
Exactly, because that's one of my big goals now is educating people with the value of thermography, because I did not understand it. But once he sat me down and explained it to me, then I was all on board. And it's been an amazing journey these last few years, the amazing things that I've seen, people I've met, things I've learned, and things I've been able to share.
Because that's where you start with people. They don't, a lot of people just don't know about it, or they don't believe in it, or, so let's hear more about what thermography is.
Well, it's imaging the body with a thermal camera, and a technology started originally with the military with night vision goggles. But many of us don't realize, but Hippocrates understood many years ago that anytime the surface of the skin is abnormally hot or cold, that is an indication of a developing pathology within inside the body. So thermography works on that principle. So anything going on inside has a surface presentation. People that do know a little bit about thermography always think heat is bad, but sometimes heat is normal. Sometimes you'll have a very hot area, like the eyes are the hottest part of the body. The neck is very hot. Under the arms, for women, under the breast where there's a fold, is very hot. But then you want your breast to be cool. And that means that there's good vascular flow. Now, in the thyroid, for instance, you do not want to see a cool thyroid because that can indicate low function, or you don't want to see a cool area in the area of the heart because that can indicate lack of blood flow. So all these different developing issues have their own signatures. And so the doctor that does the interpreting, which is not me, I am the technician, I do the imaging and write the reports. The doctors that do it are trained to identify these characteristics. And so they can say, this is what we see is out of balance, and this is what we would recommend that you do to remedy the situation. There is a very large margin between healthy and a diagnosis, and we want to see what's out of balance before it becomes a diagnosis.
Yeah, that wait and see concept really doesn't work very well, does it, right?
Well, you hear a lot about early detection, but we say don't get it in the first place because cancers and other diagnoses don't just drop down out of the sky overnight. They develop over a period of time, and oftentimes you don't even have a symptom until it's progressed pretty far. So this is empowering. This is giving you advanced knowledge so you can take action and avoid that problem. But additionally, you can monitor what you're doing to see that it is effective instead of just throwing expensive darts at a problem.
So let me ask you, you started your clinic in 2002, then you started your thermography in '08.
Yes.
Which is a very interesting time to start thermography, right?
Yeah, exactly.
With the big crash that we had.
Mm-hmm.
But how was it for you in getting started and getting women particularly, and really people involved in being able to look at their bodies in a preventive way?
What we're doing right now is a good example. Is doing interviews. Working with other practitioners that have health conferences, or advertising in the natural magazines, writing articles, putting the word out. And it's like planting a seed. People may not accept it immediately, but then as they learn a little bit more about it, then they start to see how it works and what it means. So if you don't mind, I'd like to give you a good example I use a lot, and that's just explaining the difference between a mammogram and thermography. Now, thermography is used for a lot more than just breast imaging, but that's really how it got its start and where we use it most of the time. So mammograms are looking at structure and anatomy. They're looking for something that is already present. Mm-hmm. So they're looking for cancer. And they can identify a mass, but they cannot tell if it's cancerous or not. And so all tests, no test is a standalone test. So if they see something, they're going to send you on for further testing, which is also true for thermography. But the difference is that thermography is looking at the physiology of the body, which is the activity. So a good example would be...
And the mammogram cannot do that.
No, it's looking at what is already there. It's a picture. It's a structure. And so if you think about an EKG, that's looking at the function of the heart. When an X-ray would look at a picture of the heart, we're looking at the function of the body.
Good, got it.
So some examples could be of things that can affect the health of the breast. It could be your thyroid. And thyroid affects hormones, and we all know hormones affect the health of the breast. It's very common for me to see a woman come in and she presents with all the symptoms of thyroid dysfunction, but she's gone to her doctor, had her blood work, and the blood work comes back within the normal range. Well, it may not be normal for her. So the imaging from thermography can show if the thyroid is functioning properly. And so that is a good way to help the practitioner adjust thyroid medications. Additionally, thermography cannot tell the estrogen levels, but if you are estrogen dominant, there are certain characteristics. There's
that
a
show up
modeling
in the thermography
effect in the chest. And so the doctor would say, we recommend a hormone assessment or a thyroid assessment. Now, also lymphatic congestion is one of my specialties. I'm very fascinated with the lymphatic system because it is the root of our immune system. And thermography can show when there's congestion. And as an example, someone might have an advanced dental infection and be unaware of it. And when you go to the dentist, their x-rays do not show infections. And so sometimes it'll go undiagnosed until you're in a crisis. And I've never had this happen, but my husband did. He had a root canal, even though we knew the dangers with a root canal, but he was at a point of crisis. Now, if this had happened when I was doing thermography and we had caught it earlier, he could have addressed it before he was in a crisis.
He could have addressed the root situation before?
The infection. There's many proactive things you can do. So bringing that back to the lymphatics.
Essential oils is one, too, by
exactly.
the way,
As a matter of fact. Yes, absolutely. So when you have a dental infection that is so bad that you have lymphatic drainage from it,
meaning there's feeling swelling in the jaw, or how does it show up?
The lymph system has many functions, but one thing that it does is it pulls bacteria and viruses from the body. Additionally, it introduces rich plasma and feeds the body nutrients. But when you have a situation so bad that you've got lymph involvement, that the way that affects your immune system is, just think of it as you've got this army of little soldiers. And if all those soldiers are over there fighting that battle, you're vulnerable over here. So you might go to work and somebody's got a cold and you catch the cold. So that's an example I use, is that say somebody does come to work with a cold and half the office gets it and half the office doesn't. Well, the curious thing to me is why those people didn't get it. They didn't get it because they had a better, stronger immune system, so their lymphatic was working well. So we often see lymphatic congestion where there's been surgeries and adhesions. We see it with women wearing bras, that keep their breast warm and stationary. There's no other area in our body that we do that, and we know that there's a significant amount of lymphatic lymph in our breast. And so when you become congested, that is the perfect environment to start the disease process. And so when we see that lymph congestion, then we make recommendations for lymphatic therapy, essential oils, many different things, and then we monitor it. So the doctor would recommend coming back, the doctor that does interpreting, and follow up so we know that this has been effective. And I have images of that that we can at some point see, and so we can know that what we're doing, once again, is effective.
So a question that I have, you mentioned about a strong immune system. Can you determine that by the thermographic pictures or images that you take? Are you able to detect what strength that immune system is?
In a way. Let me give you an example. I had a woman that came to see me back when I was in Tennessee, and she had Epstein-Barr and Lyme disease, and she was non-functioning. She couldn't work.
Wow.
And so what I do is I take a health questionnaire, the health intake. And so after I got all her information of all the issues that she had, we took the images, and it was pretty astonishing the amount of inflammation and congestion that she had.
It was showing up in the imaging.
In the imaging, which was
and
a
that
good
showed up.
indication.
What did that look like for our listeners, right?
Well, a lot of times people do ask me what I see, but I really try to stay out of that because I'm not trained. I mean, I've done thousands of these, and so I do have ideas, but I don't give my opinion to the patient because I have seen things that I thought that scared me and that weren't anything, and vice versa.
Well, I guess it's more of a general question.
General question would be inflammation presents as heat.
So it'll show up as reds and yellows and oranges, like that, right?
Yes. So in the same story, this woman came back a year later, and I was taking in her health intake, and she said, I feel somewhat better, but not significantly. I just don't think I'm going to stay on this program. And I said, okay. So we did the imaging, and it was just amazing, the improvement that she had seen. So when you're healing, you don't always feel better. You take aspirin, you might feel better, but you're not healing. And
that's a really good point. Oh my goodness.
Yeah. And so it was a great motivator for her to stay on the program, but it also was great for the practitioner that she was working from, because it showed that what she was doing was effective.
Kimberly, I'm thinking about you as June is talking, because you do so much work with the food, and what sounds like would be an amazing combination. If we had,
I'm listening. I was just conjuring a question, because I deal with inflammation as the root cause of all major disease, and sugar being very inflammatory and stagnates and shuts down the liver, and also, it does affect the liver, but your lymphatic system, also your killer cells, your white cells, and the lymphatic system and the spleen, as part of your immune system. So yeah, what I love about thermography, and I've been getting it done for over 10 years, is that it's a picture. And people like pictures, and they like to see how their pictures change. And so the feedback is great, but you cannot feel systemic inflammation. That's what people don't understand. Most people are systemically inflamed, and the thermography is a great way to pinpoint that. So I also had a little inflammation in my jaw. I cured it with oregano oil and coconut oil. I just put between my gums, and within a month it was better. But it's amazing.
So simple like that.
I've done full body, I've done half body, I've done just breasts, and so inflammation is the biggest thing that I love seeing from this.
Well, another thing to consider is that I did tell you that I am certified as a colon hydrotherapist. And when I first started in the year 2000, I didn't even know what celiac meant. I mean, nobody had it hardly. It was very rare. And now everybody is gluten intolerant because of the GMOs. And so oftentimes people will have these food sensitivities, and they're not understanding because, say, for